So you got into cosmetics because you said you're passionate about the skin, but you were also hoping it would make you some money. So let's talk about the money. On December 13th, Eli Lilly, the world's first trillion-dollar healthcare company, sponsored two events in the community right here in Houston, focused on alopecia education. Two events the same day, the same sponsor, the same community need. But my question is, why didn't they combine them? Now, before you ask, hey, what does this have to do with my aesthetic business? I want you to stay with me because the answer to that question reveals exactly how corporate healthcare thinks about community investment, strategic partnerships, and where dollars are moving this year. By the end of this video, you're going to understand how to position your business inside corporate sponsored health equity initiatives, how to build partnerships that generate revenue without chasing social media followers, and why following the money is the smartest business strategy you can adopt right now. Welcome in TikTok. As you join, let me know in the comments what city you're joining us from. I'm going to make an adjustment here. Okay. And as you come into the room, YouTube, let me know where you're joining us from. We're going to cover 5 lessons tonight. 1, why Eli Lilly sponsored 2 events, what this tells us about their market strategy. Then we're going to talk about the missed opportunity, what a combined event could have accomplished, and what NPs can learn from it. How to position yourself inside corporate sponsored health initiatives, the partnership model that most of us are missing. How to follow the money, where healthcare investment capital is actually moving, and how to align your business accordingly. Then we'll talk about your action plan, 3 steps to build these partnerships in your market, and what you can do starting Monday. Before we jump in, I'm Kimberly Madison, a doctorally prepared nurse practitioner and the founder of the Alliance of Cosmetic Nurse Practitioners, where I coach cosmetic NPs on how to master sales and financial literacy so that they can build businesses that run without them and not because of them. I come live here. I always record live. You can find me on YouTube and LinkedIn under the live tab. We have a whole money playlist for you. That's where you'll find this video. Before we get started on our content, we always do a devotional or a prayer. This is coming from the Jesus is Calling for Medical Professionals by Sarah Young. We'll do this and then we'll get into our topic. As you join the room, let me know what city you're joining us from. Hello, Angela, Mommy, Mile VV, Fiducia Health and Wellness. Welcome. Okay. The title of this devotional is called Problems Are Opportunities. I want you guys to see yourself as problem solvers, not as the best injector, not as a solo practitioner, as problem solvers. When you see yourself as a problem solver, you can solve any problem anywhere at any time. That's nursing. If you're wondering what is nursing, that's nursing. We're problem solvers. So this says problems are opportunities. It's all about reframing and how you look at a situation. So when tests and challenges come at you from all sides, and if you keep living, they will continue to do so. Consider this a joyful opportunity. Don't waste energy regretting the way things are or wishing you could go back to yesterday. Remember that I am sovereign, powerful, and loving. Moreover, I am with you to help. Instead of being overwhelmed by all the difficulties, grasp my hand with confident trust. Though you are insufficient to handle your troubles by yourself, you and I together can handle anything. That's our theme for tonight. If you can view your circumstances from this big picture perspective, you can be joyful even in the midst of your struggles. You have not only my presence with you, but my spirit within you. He is always ready to help. Seek his assistance as often as you need. One of the hardest parts of dealing with multiple trials is waiting for their resolution. Since patience is part of the Spirit's fruit, he can help you endure the waiting. Don't try to get out of hard times prematurely. Instead, persevere patiently, knowing that perseverance must finish its work, making you mature and complete. We have 3 scriptures. The first one comes from James chapter 1, verse 2. Consider it a sheer gift, friends, when tests and challenges come at you from all sides. Galatians 5, chapter 5, verses 22 to 23. But the fruit of the Spirit is love, joy, peace, patience, kindness, goodness, faithfulness, gentleness, and self-control. Against such things, there is no law. And lastly, James chapter 1, verse 4, perseverance must finish its work so that you may be mature and complete, not lacking anything. May the Lord add a blessing to the readers and hearers and doers of his word. We're here to take action. If you haven't already, take out your notebook. So here's what happened on December 13th in Houston. In the morning, went to a community health clinic owned by a family physician who treats a lot of dermatology cases because her patients can't access specialists. That's a problem we have in dermatology, is a provider shortage. That's what me and Jade wrote about in our upcoming article in the Journal of Clinical and Aesthetic Dermatology, where we talk about the utilization of AI to increase access to patients, particularly in what we call provider shortage areas. Even Houston, even though it's densely populated, is considered provider shortage because when you look at the number of patients who need to be treated by a provider, there's simply not enough. And we see this all over healthcare. Her patients have a hard time accessing a dermatologist. So in turn, you know what happens? She treats them. Now, she partnered with a local African American health coalition to host a free alopecia education session. Give away your best stuff for free. If you're in business, that's the secret. When people see how much they learn and benefit from you giving away your best stuff, they can only imagine how much more you're going to help them when they actually pay you. Now, a board certified dermatologist from nearby, right here in Houston, came in to provide the specialist expertise. And this event, it was sponsored by Eli Lilly. Now, in the afternoon, I went to another event hosted by a dermatologist from an academic medical center she led another alopecia education session, also focused on serving communities experiencing disproportionate rates of hair loss and lacking access to dermatologists trained in textured hair. Again, sponsored by Eli Lilly. First question I have: two events, two providers, two locations, the same sponsor. Why didn't they combine these events? Now, Eli Lilly, they didn't sponsor these events out of charity. This is a $1 trillion company. They sponsor community infrastructure because trust is built in communities, not purchased through marketing campaigns. Now, just think about this. Eli Lilly's entire business strategy right now, it's not weight loss, it's metabolic disease dominance. Okay, so we have Mounjaro, we have Zepbound. They're generating over $10 million every quarter. They're treating obesity, diabetes, cardiovascular disease, liver disease, and sleep apnea. They need patients to trust them for long-term chronic disease management. If you didn't notice, Eli has now changed their messaging from just specializing in weight loss, because we've seen the data show that when weight goes down, we see all these benefits in weight, diabetes, heart disease, liver disease, and sleep apnea. They're all connected. So Eli recognizes what's ahead of them. They've changed the messaging, right? The next step is the pill. After that, there is no after that. They're going to dominate the market. They've already been around for decades when it comes to investing. I already told you in December when we did that whole series on financial literacy for Cosmetic and Peas that if you're looking for a stock and a company to invest in, start with Eli Lilly. You're already in the industry. You already understand the game they're playing. You already know how many of your patients have all of these diseases, if not at least one of them. You understand how important it is for us to decrease these outcomes. You understand how long people have been waiting for a weight loss pill. You don't have to know everything there is to know about financial literacy. You just need to understand the problem. Now, they need patients to trust them. And what are we? We're trusted people in the community. Now, where do you build that trust? In underserved communities where people can't afford specialists, where mobile health screenings are the primary access point, and where corporate sponsors show up and provide free education when no one else does. That's how you do it. So when those community members eventually need metabolic health management, they remember who showed up for them. They remember that Eli sponsored the event where they learned about their hair loss, where their questions were answered, where they felt seen and heard. They remember that free screening. They remember feeling cared for. Remember, people want to know more about how much you care than how much you know. Once they feel that you care about them, then they care about your credentials. They care about what school you went to. They care about all the stuff we tend to lead with in our titles, right? Now, that's infrastructure investment. But I want you to ask, why did they have two separate events? Now, the benefits of combining these two events could have accomplished so much more. Now, let's talk about it. Number one, economies of scale. Instead of two small events with limited reach, you could have one larger event that serves more people, generates more community buzz, gets more media attention, should have been in the news, and creates a bigger impact with that same sponsor budget. Okay, less effort, bigger impact. Number two, cross pollination of expertise. You have a family physician who understands primary care and community needs, a private practice dermatologist, and an academic medical center dermatologist all in one room. That's three different practice models, three different perspectives, three times the knowledge transfer. Number three, a stronger partnership infrastructure. Now, the African American Health Coalition was involved in the morning event, but not the afternoon. Why not leverage their community organizing power for both events? They already have the community trust, the networks, and the promotion channels. This is where we talk about working smarter, not harder. Even for a company like Eli Lilly, this video is for Eli. This is me pitching Eli Lilly. Someone over there needs to hear this video. Please share it with someone over there. You could have gotten so much more bang for your buck. Number four, better resource utilization. Instead of Eli spreading their investment across two separate events, across the whole day, it took up the whole day, right? They could have put more resources into one comprehensive event, for a better venue, more educational materials, follow-up screenings, even trichoscopy demonstrations or scalp exams on site, which they actually did. But you could have expanded that. Maybe you could have gotten email lists, social media content, testimonials. Number five, data collection and follow up. With that combined event, you can track your outcomes so much better. How many people actually attended? How many were referred for those alopecia, or maybe even more specifically for CCCA? How many were referred for treatment, and how many actually followed up? That's how you have a problem. You put in a intervention. You evaluate how well that intervention worked. You have to identify some outcomes that you can measure so you can tweak those outcomes and repeat the whole thing and get better results. Now, that data becomes the foundation for grant applications, research initiatives, and securing more corporate sponsorship the next year. So, why didn't they combine the events? I don't know. Maybe it was a scheduling conflict. Maybe the different organizations have different missions. Maybe they didn't know about each other until it was too late. But what's the lesson for you? If you're a nurse or a nurse practitioner, Stephanie's always here. Everyone put a heart in the chat for Stephanie. Talk about support. Okay, now the lesson for you, when you see an opportunity like this, we just talked about opportunities in our devotional, you can be the connector. Now, before we keep going, if you're getting any value from this, please hit the subscribe button, turn on your notifications so you don't miss every time I go live. These new videos post every Tuesday at 11 a.m. Central Time. I do batch content whenever I'm available. You can be joining me live like I am now. Otherwise, you just have to wait till they get posted with the rest of the public. This gives you VIP exclusive access. You don't have to wait for me to respond to your email or your DM, and you don't have to pay me. You can be directing how this conversation goes right now. Let me know in the comments if you've ever partnered with a corporate sponsor, even if you were the employee. Just think about it. You're not coming in this with blind. All of you are coming in this with lived experience, some kind of work experience. Lean on that. Don't lean on what you don't know. Have you ever worked for someone or yourself organized a corporate sponsor for some kind of community health event? It might have even been at your church. Or is this something you're interested in exploring? I want to know where you are on your journey. So let's talk about how you can position yourself in these partnerships. Most cosmetic and dermatology NPs think corporate partnerships are out of reach, or you're only seeing that you can only work with them in one way, being the prescriber who writes the prescription, or the one who does some kind of educational event for them, or maybe even on an advisory board. Those are all wonderful opportunities. In addition to this one, now, and I've even partnered with them in the community for the DMV Dermatology MPPA group. We've had them sponsor our dinners where you get education, you get to network, and we've even brought in other partners who we think we all have alignment in our mission. Really think outside the box here. Now, they think that you need a massive social media following or connections to pharmaceutical reps or some special access. Actually, that's not true. Corporate sponsors like Eli Lilly are actively looking for healthcare providers to partner with on these community health initiatives. They have health equity budgets, they have community investment programs. They are required to demonstrate community benefit for tax purposes. And what do we know about our NPs and our PAs? We're more likely to care for patients in the communities that we grow up in, especially in dermatology. This is the data. The data shows that a lot of dermatologists tend to move to places that have higher cost of living. Think of your Miamis, your LAs, your New York, maybe DC, maybe even Houston is on that list, right? So, what about all our clients who aren't in those big cities, who are outside those parameters? A lot of your APPs, that's your NPs and PAs, we tend to live in those communities. We're helping to increase access to care that way as well. Okay. So, how you can position yourself. Number one, identify a local community health organization. Google, ChatGPT, Gemini your life away, Community Health Coalition, put your city in there, or Health Equity Nonprofit. Look for organizations serving whatever community you think is being underserved. That can be Black communities, Latinx, immigrant populations, low income neighborhoods, faith-based organizations that are aligned based on culture, ethnicity, phase in their life. Really think outside of the box. Contact them and ask them, what community health events are you planning? I'm a nurse practitioner. I specialize in dermatology and cosmetics or wellness, and I'd love to provide free cancer screenings or alopecia education, or something aligned with those metabolic diseases that I went over. Number two, offer value before asking for anything. Don't lead with, can you help me market my practice? Lead with, I can provide free screenings, education, and referrals for your community members. Show up, focus on who you're here to serve, build that trust. Demonstrate that you care about health equity, not just revenue. Then I want you to document your impact. Track how many people that you screened, what conditions you identified, how many referrals you made. If it's possible, depending on what they have going on, take photos with consent, collect testimonials. This becomes your portfolio for approaching corporate sponsors directly. Number four, I want you to approach corporate sponsors. Research which pharmaceutical companies sponsor health equity initiatives in your region. Email their community investment departments. Introduce yourself as an NP specializing in whatever your niche is with expertise in serving underserved communities. Attach your impact portfolio. Offer to participate in upcoming events or propose a new initiative. And number five, build those ongoing partnerships. Once you're in, you can't disappear. This is where you nurture the relationship. What are we really good at? Building rapport, building trust. It's relationships. Business at the heart of all of this is relationships. Getting a job, getting into that program, getting an opportunity, getting a discount. It all comes down to your relationships. Even growing your business, getting people to pay for your goods and services. It's going to come down to how well you build those relationships. That's that know, like, trust factor you hear us talk about all the time. So once you're in, don't disappear. Follow up. Propose what are going to be the next steps. Offer to speak at their events. Write blog content that they can share. Position yourself as their go-to NP for community health partnerships in your area. This is how you build a practice or a business that doesn't depend on social media followers or paid ads. You build relationships with these well-known, credible organizations that already have community trust, and you position yourself as the clinical expert that they need. Now, let's zoom out and talk about why this matters strategically. Eli Lilly became $1 trillion company by pivoting to metabolic disease. If you're an entrepreneur, pivoting will become your middle name. It's inevitable. That's why we tell you, you can't perfect an idea. You just need to get started. Whatever idea you have today, it will not be the same idea you have in 6 months. It will not be the same idea that you're executing in 2 years. That's just the nature of business. And that's why you have to see yourself as a problem solver, because the problem that you solve and for who is going to shift with the market. You don't want to see yourself as doing one thing. And then when you can't do that one thing, you're out of there. That's a waste of time and money. And both of those things are too precious to waste. Now, Eli Lilly became this $1 trillion company by pivoting to metabolic disease. They're not just treating diabetes or obesity. They're treating the whole metabolic syndrome. cardiovascular disease, liver, kidney, sleep apnea, osteoarthritis. How many people do you know have osteoarthritis? Every time I do an assessment on a patient, at least 75% of the time, I'm looking at some old healed knee incisions. So many knee replacements. Now, their 2025 clinical data showed that Mounjaro reduces cardiovascular events by 16%, improves kidney function, it treats heart failure. This isn't just a weight loss drug anymore. It's metabolic health drug. And here's what most people don't realize. Dermatology intersects with metabolic disease all the time. The skin, the largest organ of the body. It is an external view of what's happening on the inside. Sometimes it's the first sign that there's a problem, and sometimes it's a sign that things have gone on for far too long untreated. Think about it. Acanthosis nigricans, insulin resistance, your skin tags, metabolic syndrome, hidradenitis, strongly associated with obesity and metabolic dysfunction, psoriasis, also linked to cardiovascular disease. If you're a cosmetic NP only thinking about Botox and filler, you're missing the opportunity to integrate metabolic health screenings into your aesthetic consultations. You already can do this. You don't need outside validation. You don't need a perfect job in the perfect city at the perfect time. It doesn't exist. You already have these credentials. I tell you all the time, nursing school ignored skin of color completely. Dermatology training overlooks entrepreneurship, and cosmetic training, they don't care about your nursing experience. They're going to tell you straight to your face. They don't care that you've done this for 20 years. They don't care that you have 3 degrees, that you worked in the ICU. They literally only care about those 2 years of cosmetics. But if you understand and value your nursing education, you already know what you're coming in with at baseline. At baseline, I just told you we were at that primary care clinic. She's treating a large percent of dermatology patients because there's a provider shortage. As an NP, you can serve those mild cases. You can serve some moderate cases. You can be the bridge while they're waiting for that 3 or 6 month appointment. Get them started on something so that they're not making things up in the kitchen. Provide that education as you continue to learn, because if you continue to show up, you will continue to learn. You can increase your confidence, increase your clinical training, continue to invest in your education, invest in mentors and coaches who will give you that guidance, that direct clinical training and the direct mentorship. Pay for that. You're going to get a huge return on your investment when you do that, and you show people coming behind you that they're worth that compensation, and it elevates our practice. Okay. We can't just give away everything because it costs us money to get here. We can't be afraid to talk about the money. Now, you keep showing up, you build your confidence, you continue to network, you continue to learn, you continue to have that discipline outside of wherever you work and get paid. You have to come home and establish your own level of discipline. That is a reflection of the care you're able to provide. Over the course of time, you will be able to take care of more patients, or you can stay right there and continue to be the bridge while they wait for that specialist care. But my friends, you can already help bridge the gap and address that provider shortage area that we're talking about. Now, the strategy here is that when Eli sponsors alopecia education, they're not just building goodwill, they're positioning themselves in communities that will need their metabolic drugs in 5 or 10 years. They're building trust right now so that when those patients need Mounjaro, Zepbound, or whatever comes next, they remember who showed up. You should adopt the same strategy. Partner with community health organizations, show up to those free screenings, educate about skin conditions that signal metabolic disease, build those referral networks with primary care, cardiology, and everyone else, right? All these diseases show up in every part of the body. They're all connected. Position yourself as the NP who understands the whole patient. That's nursing, holistic care, not just their cosmetic concerns. Because you're going to be the one doing that education. I tell you all the time, nobody understands nursing. Okay. Nobody understands it. So that's our job to do the education. Hey, I know you came in for this one concern, but did you know that the data shows that this is connected to X, Y, and Z? Is that anything that you've had any concerns about? Oh, why, yes, I did. Opens up the gate, opens up the door to conversation. But you can only do that when you're educated. Now, in 5 years, the cosmetic NPs who win won't be the ones with the best Instagram filters. They won't be the ones with the highest social media follower count, which, by the way, the marketing strategy has changed. I just taught in a workshop last week to the Alliance of Cosmetic Nurse Practitioner founding members. The new marketing strategy in 2026 has nothing to do with your follower count anymore. Okay. Now, these MPs, they're going to be the ones who understand well, healthcare dollars are moving and position themselves accordingly because they're going to follow the money and then they're going to follow the model. Now, let's make this action. This is where you need your notebook. Okay. Action number one, have your notebook out, wherever you put your notes at. This is where you're going to do some work now. Okay. We've given you the problem. We've described the landscape. We've given you strategy. Now it's time to do something. This is where we do execution. Remember, ideas are a dime a dozen. People get paid for execution. That's it. Okay. It's only what you do, not what you're thinking. Now, action number one, research community health organizations in your area. Spend 30 minutes, 5 minutes, whatever you have. Find 3 to 5 nonprofits that are working on health equity in your region. Look at their website. See what events they have coming up. Email them and introduce yourself. Action. And if you can't meet in person, set up a Zoom call. Pick a date, pick a time, and just get it done. Action number two, offer to provide free screenings. Oh, and actually, you know what? Even a better tip? You want to have a calendar. If you're going to be out here trying to make connections and build relationships, it wastes so much time going back and forth in email or text. Go to Google right now, set up your calendar. It is absolutely free. If you want to invest in something a little more, you can go invest in those. But right now, start with a Google, set up your calendar, put in the dates that you're normally available and the times every week. When you go set up that email and introduce yourself, provide your link. Now, when they read your email, they too can take an action, book it, and then you just wait. You just show up for that meeting. That's how you save even more time. Because remember, in entrepreneurship and in business, time and capital are always limited. You don't have time to waste going back and forth with email. Oh, I'm available here. I'm not available here. And then if their schedule changes, especially you're talking about someone who works in healthcare and takes care of patients, our schedule changes all the time. They can go back into that link and just reschedule. Again, saves you so much time. So, action number two, you've introduced yourself. Now you're going to offer to provide free screenings. It could be skin cancer, alopecia, acne, melanoma, whatever your clinical expertise is. If you can take it another step further, you can do a SWOT analysis of your neighborhood, the businesses that are there, and if you've ever evaluated like a healthcare entity, they do community health assessment reports. When I was at Georgetown and I was a student at George Washington University, that was one of the assignments we had to do. I had to find their community health assessment report, and it basically tells you kind of all the health outcomes, all the problems, all the suggested strategies for that community. Go in there. That's going to immediately tell you where the gaps are and where you can provide the most value. You're going to package this as a free community service. Offer to bring educational materials with your brand on it and show up with your professional presence. Then you're going to document and follow up. Depending on the situation, depending on what you negotiate when you make this arrangement, you might be able to take some photos, collect some stories, written, video, track your impact, send a follow-up email thanking the organization and sharing the outcomes with them. Offer to do it again, build that relationship. I'm telling you, everyone needs help, even Eli Lilly. This video is for Eli. Whether you're making your first 10,000 or your next 10 million, everybody needs help. Everybody's trying to figure it out. Everybody. Then, once you have 2 to 3 events under your belt, that's when you approach your corporate sponsors with a proposal. I've been providing free dermatology screenings in underserved communities. Here's the impact I've made. That's the data. When you want to talk business, you have to talk numbers. Sometimes those numbers are money. That's why you can't be afraid to talk about it. And you say, I'd like to expand this work with your sponsorship. That's how you build infrastructure. That's how you follow the money. If this is making any sense to you, TikTok, put follow the money in the comments. Now, if you have questions too, for some of you, this might be a little bit, might be new, might have a lot of questions. One thing I love to see is people asking questions. I have learned the most by asking questions. The people who are the smartest know that asking questions is the secret. It's only people who don't know what they're talking about typically don't have a lot of questions. Okay. I learned that as a struggling student. And then when I actually came to class prepared, I knew what questions to ask because I was familiar with the content. This is a safe space. This is for learning. That's that financial literacy. Want to have a safe place for you to learn. It's like we want to have a safe place for our patients to learn. They are literally the same thing. You want them to have a good health literacy foundation. I want you to have a good financial literacy foundation. So once you have this foundation and you have the language, when you go hire that professional, you'll have somewhere to come from. You'll have a reference point. You'll know how to ask good questions, how to evaluate if they're a good person to work with. Just like our patients. Our patients don't know healthcare, they don't know medicine, but they know their body. And we give them language. It helps make our time more efficient. It helps us have better communication, and it makes their management so much better because they're the one managing their health. It's not you. You're just giving them what they need. So they're going to be able to go home and tell their family, hey, what happened in that appointment today? They're going to be able to go to the pharmacist and pick up their medications and know why they're taking them and how long and when to call you back. It's the same like you. When you go and evaluate 3 or 4 different financial advisors, a CPA, an accountant, a business strategist, you're going to have some language. You're not just going to go in there and say, well, I don't know anything and give them all your money. Because at the end of the day, it's that patient's body. That's their body. You can't own it. You can't make people do anything that they don't want to do. That person, that expert, at the end of the day, it's still your money. You're still going to be responsible for the outcome. So you need to have the language, you need to have the literacy and the fundamentals. That's all I'm giving you are the fundamentals so you can have the confidence to have the conversation and to take action. Now, what I want you to remember from today is corporate sponsors like Eli Lilly, they're not just investing in community health out of charity. They're investing because trust is built on communities, not purchased through marketing. Although marketing is wonderful. I love marketing. You can't outsource all of your marketing. You got to at least understand some of it and really appreciate it. If you are outsourcing your marketing, appreciate that person because that's a lot of hard work. And as the nurse practitioner, you can position yourself inside that infrastructure. You don't need 1 million followers, friends. The whole social media algorithm has changed. Followers don't matter anymore. You need strategic partnerships with organizations that already have community trust. You need to show up, provide value that you already have, and document your impact. Follow the money and then follow the model. If this resonates with you, I actually have put a link in my description box on breaking down this whole strategy for you. I've also talked about the Flexner Report's impact on Black physicians, resources like HUD for cultural awareness training for you and your staff, and exactly how to integrate metabolic health into your aesthetic business. Those links are the link is in the description box. You can go read them on the Mahogany Dermatology blog. And if you want to learn how to build a practice grounded in these principles, health equity, business strategy, and the 9 pillars of advanced nursing practice, then the Alliance of Cosmetic Nurse Practitioners is where you can find all of this. We invite you to join the waitlist at cosmeticnp.org. Thank you so much for watching. Don't forget to subscribe, hit the notification bell. Please drop a comment letting me know one action step you're going to take tonight. Don't wait till tomorrow. Tomorrow's not promised. Let's find ways that we can keep each other in business. I hope you found any of this valuable. I think I'll be back tomorrow night to do a little bit more batch content. I have some show and tell too. So if you're around tomorrow and you subscribe, you'll be notified when I go live, probably in the daytime-ish, a little earlier than today. But I have 2 resources that I want to share with you that I've been into lately. When I first started this YouTube channel, I used to do a lot of show and tell. And I'm going to bring a little bit of that back tomorrow. So I'll see you tomorrow night. Thank you all for watching. If you enjoyed this, then you're going to love the money playlist. Go over there. You're going to see me talk about, what did we do last week? Oh, the MBA masterclass with Emma. She interviewed the founder of the Shade Room. We talked about not only what she did and how she evaluated a business publicly and what you can learn from that, but also the importance of having these conversations together. And the biggest takeaway from this Eli conversation is that so much in nursing, we struggle in silence when we suffer in silence when we work in silos. There's no reason you have to figure everything out, friends. There's no reason. You're not the first person to be a nurse practitioner, or to be an entrepreneur. You're not the first person to try to struggle and do this while you're married, having children, planning a wedding, going through a miscarriage, going back to school, moving states, going into a new home, switching jobs. spouse transitioning to a new position. You're not the only one. You're not the first one. And you're not the last one. You do not have to do this alone. There's over 5 million of us. There's no reason there should be 2 events in one city working that hard. It takes so much work to do that. There's no reason you have to do that by yourself. There's no reason. I hope you're inspired to go out there and make partners. They don't have to be your friend. You just have to understand the principles and what the outcome is. And at the end of the day, who benefits from this the most? The patient. That's why we're here. And remember, nurses are patients too. Go ahead and click on the money playlist, and we'll continue this conversation there.